All right, Kinesiology 1018, welcome to our part 3 of creating our general fitness program. Today we're going to talk about guidelines for people with special health concerns and of different ages or places within their life, stages within their life. Okay, first one is children and adolescents. Children and adolescents require exercise every single day, which I'd say we all do. So create opportunities for exercise and physical activity for children. If you have a brother, sister, son, daughter, a grandson, granddaughter, find opportunities and family outings and things that you can do that are more physically active. Okay, maybe it's going to the park. Okay, maybe it's going for a walk. Maybe it's finding some kind of activity. Maybe it's playing soccer, playing basketball. Whatever activity it is, find activities for physical activity to improve the opportunities for your children and adolescents to improve their life long term. Because the more fit we are when we're young, the more likely we're going to keep engaging in physically active behaviors. If you feel that you aren't very good at physical activity, you're probably not going to do it, which is going to harm your quality of life down the road. Okay, and then for children like around 12 and younger, develop some kind of skill and fitness and work on being a more active person. Okay, maybe it's swimming, maybe it's basketball, learning how to play and learning those skills, becoming more fit through just playing those kinds of sports rather than looking at it as a win-loss. Okay, I know you think that your son or daughter's Little League baseball game is the World Series. It's not. Okay, and they're not going to remember if they won or lost that game in the next 3 days. Okay, you could probably ask them on Tuesday, what was the score of their game on Saturday, and they probably can't tell you. Okay, but they'll know exactly what they did. So helping them develop skills and fitness are best when we are working with younger kids. Okay, as you get into older ages, maybe later high school, developing post-pubescent phase, adolescence, developing more skills and developing a higher level of fitness for more competition is okay. But let's push that to where we're pushing them into just a better overall physical environment. Okay. For pregnancy, make sure that you see your doctor first, okay, and ask if there are any things that you can't do and anything that you should do. You should continue to exercise, but low weight-bearing activities are more favorable. Okay, to choose those where you're not putting excess stress, especially later on through pregnancy, and avoid supine position, especially after the 3rd trimester. Okay, so activities where you're moving around where you don't have to be in this supine or laying down in your back position. And then make sure that you're looking for activities that have a lower risk of falling, okay, in general. A lower risk of falling is kind of the best one, where you're not going to lose balance, not going to fall. Those are probably the ones that you need to watch out for. Okay, but being physically active, resistance training, cardiovascular endurance training, flexibility training, they're all fair game as long as you are being safe and making sure that you check in with your doctor. Okay, you can also look into there are exercise specialists for pregnant women. Okay, that's their specialty, is exercise during pregnancy, during and after pregnancy. So there's opportunities out there for you to improve your fitness regardless. Okay, make sure that you're drinking plenty of fluids, as we would recommend for anyone, and then try to resume fitness gradually post-pregnancy. So become physically active after pregnancy too. Children are also a great form of resistance exercise. They're very progressive. They add pounds over time. So they grow and they get heavier as you get stronger. Okay, so just go around and pick up your kids. Boom, you're getting some resistance exercise. You can do some bonding baby lifting exercises. That's supposed to be funny, but come on. All right, for older adults, the same guidelines as younger adults are fine, but we want to look at more of an RPE scale rather than looking at heart rate. Okay, so trying to get them into where it is moderate, challenging, hard. Okay, that's where we want to stick to, kind of that yellow zone. And kind of that yellow zone. Okay. For strength training is actually extremely beneficial for older adults. Okay, loss of muscle mass is a big indicator of low quality of life. Okay, because that means you can't move around, you're not as functional as a person. So trying to improve flexibility and improve strength in older adults is amazing. It helps with bone mineral density. It helps with overall functional activities. So exercise as you age. Once you turn the age of 50, you should probably still be exercising. Once you hit 60, still be exercising. It's not something that can stop. Think about exercising as a part of your diet, something that you have to eat and consume every day to be a healthy person. Okay, make sure that you warm up and cool down and drink plenty of water, and make sure that you modify your activities based on your limitations. So if you can't walk, there's exercise that you can do while you're sitting in a chair. Okay? There's all kinds of things that we can do, and there are professionals who are focused around these specific limitations. Okay, so what about people with special health concerns like arthritis? Okay, arthritis is where we have a breakdown of cartilage in the joints. Physical activities that are low impact, especially things like strength training, are very beneficial for people with arthritis. Okay, so flexibility and strength training are awesome. Lower impact activities, so running may not be the best, but walking may be okay, or cycling, and strength training would be best for people with arthritis. Okay, for people with asthma, okay, make sure it's self-paced, make sure that you warm up and cool down and have your triggers in mind. So if you know that certain weather or heat or dust or pollen triggers your asthma, make sure that you have your inhaler and make sure that you have someone else exercising with you. Okay. You don't want to get into that situation where you're having an attack, you don't have your inhaler, and you don't have anyone to help you. Okay, so be smart, be aware to prepare yourself. And if you have diabetes, make sure that you are not exercising alone, and make sure that you've discussed this exercise protocol with your doctor and an exercise professional about diabetes. Okay, especially if it's type 1 diabetes, you need to watch your timing, you need to pay attention, you need to know how your body's going to respond to what you're doing. Okay, if you have something like, if you have to check your blood sugar beforehand, if you have to wait, or if you have to have sugars before, keep sugars available, make sure that you're talking to your doctor and aware of what you need to do. If you have type 2 diabetes, make sure that you are putting yourself in a place where you can exercise. And if you have any issues with numbness at your extremities, so diabetic neuropathy, if you lose feeling at your feet, make sure that you are checking your feet, checking your lower legs, because we don't want to have any kind of blister or abrasion that could turn into a secondary infection. But one of the really big benefits for people with diabetes, especially type 2 diabetes, with resistance exercise, it improves your ability to take up insulin and take up sugar. So strength training has a positive effect on lowering or creating more insulin sensitivity, where you are more sensitive to that insulin and you are more capable of taking up sugars out of your blood and improving your blood sugar levels. Okay, so I do recommend for people with type 2 diabetes, start out with resistance exercise. It's often lower impact, easier to perform cardiovascularly, and is a great way to start out and improve your life. Okay, with heart disease and hypertension, make sure that your physician says you are okay. If you need your cardiac specialist to check in with you, do exercise stress tests, do so. And try to keep it to somewhere around a moderate intensity, not a higher intensity. We don't want to go into any space where your body is not prepared to handle that kind of heart rate. If there's any dizziness or pain, stop. And if you have any kind of medications that you're taking or or any issues there, make sure you and your doctor are on the same page, and your doctor and your exercise specialist are on the same page. Okay? Because if someone is helping you exercise, make sure that your doctor and that exercise specialist know what the plan is for you to improve or to maintain your health and wellness. Okay? If you have heart disease or hypertension, okay, make sure that we're not doing things where we have to hold our breath tightly, because that's going to raise our blood pressure, especially if we're at risk for something like a stroke. Try to avoid those kinds of exercises and increase your activity gradually. Okay, for those with obesity, okay, starting out low to moderate intensity activities with low weight or low load bearing, so things where you're active, but you're not in a high impact scenario. And we know that you need to exercise at least moderately for about 30 minutes per day to lose weight, okay, without modifying diet at all. So adding in more physical activity is really key here to improving and adding to those benefits of the 60 minutes of exercise you're doing every day. Okay, choose activities that are low weight bearing activities, but I would recommend resistance training for this group also, okay? Because the more muscle mass we can create on our body, the more muscle mass, the more energy expenditure we have at all points throughout the day, which means you are using more calories to be alive when you have more muscle, which can help with improving that process of losing adipose tissue. And at the same time, the more muscle mass that you develop, the more functional you are within your environment. Okay, so you can move around more effectively and efficiently, which means you're more likely to move more often. Okay, the more often you move, the more weight you lose. Oh, it's just this great cycle that comes from improving your functionality. Okay, with other things with obesity, include strength training. Okay, just talked about that, and just more physical activity in general. Okay, do more activities. Okay, get up and move. And we want to limit that sedentary time as much as possible. Okay, my watch does it. It has a little buzzer on it whenever I'm not moving for too much. It just says move. So maybe that could be a helper, having something where it's an alarm every so often, or you have something like an Apple Watch or a Garmin watch, or something on your phone that when it's sedentary, it tells you, hey, you've been sitting down too long. You should probably go move around a little bit. That can help you in adding more physical activity in general. Okay, with osteoporosis, osteoporosis is the loss of bone mineral density. So you have more fragile bones, which means you're at risk of fracture from falling, or a higher risk of fracture. This is often in older adults and older female adults. Weight-bearing activities and muscle strengthening activities are best for this population. Okay, activities where you have to create tension within your muscle, you have to walk, jog, do that little in-between walk jog thing. Anything where you're strengthening your muscles. Okay, this could be machine exercise, body weight exercise, banded resistance, weight resistance, any kind of resistance. Okay, anything where you have to use your muscles to create force. Okay, as long as you're doing that and you're doing that regularly, okay, at least 3 times per week, this will help to stave off osteoporosis, or even in some cases improve bone mineral density in people with osteoporosis. So strength training in individual or in older adults, especially older women, is key to healthy bones. So strength training isn't just muscle training, it's bone training as well. All right, thank you very much for watching. Our next video will be based around your activity.